Though I feel old, I tell my kids, every year that goes by, I get wiser. But I don't feel that here in this room because I see all of y'all have gone ahead and seen a lot, experienced a lot, gained a lot. So I'm here not to share anything more than that but something that I have gone through in life and how God has led me to where I am today. As you all know, I'm Anita Daniel, and I'm the batch of 1995. And we call ourselves as more than conquerors because that's the only way out, right? Start nursing. And it's been God's grace that we have come through and conquered, and it's not us, but it's God who has led us. It's a privilege to be here amongst a big group of a foster batch of 1992. So it really feels home, and honestly, I needed this for my soul. I think in our journey, wherever we are, we can get lost and we can get sidetracked and we can lose our focus. So I really thank God for bringing me here, and all kudos goes to Jessie Chechi, who's been insistent, persistent, and encouraging to be here. So I thank you, Jessie Chechi, for that. So as Vincia mentioned, I'm with case management, care management, currently in a leadership role. Would I have chosen this pathway? Absolutely not. The reason I came to the United States is, hey, you've got various nurse practitioner programs, right? So that intrigued me. That was the only or the top reason why I even got a visa, got a passport when I took first my NCLEX exam. I didn't have a passport because I was born in Vellore, raised in Vellore, did my schooling in Vellore, and I did my bond and all of that. So who lived in Vellore the longest might be me. So when someone said, hey, you like to go to the United States, why should I go out of my country? I'm happy where I am, right? But the nurse practitioner program intrigued me. But where I am today is not what I wanted to be, but I thank God every second of my life now where I am, because like as Ms. Margaret said, I'm fulfilled and I enjoy what I do. And when she said, I enjoy what I do, man, I said, that's what I feel right now. So that just brings to a full circle to say, if we yield to God, right? If we yield to what He leads us, He will lead us through green pastures. He will satisfy our soul. So I'm here to kind of talk a little bit about how the alma mater has encouraged me, has contributed to what I am today. A little side note, my mom is a medical social worker in CMCH. So I've seen her, I've observed her working. Some of you know she's Mrs. Joyce Rajan. She's done social work in rehab, she's done in mental health, she's done it in Medicine 1 with HIV patients, pre and post counseling. So I worked in community health nursing, right? So you have a 1 hour lunch break, 1 hour, you remember that? So I used to go to my mom's office and have my lunch, and she has a little couch there, and I will take a snooze and then, refresh. But I always saw her being so passionate about what she did. As a nurse, it's like, really, just let's be honest, were we passionate with what we did? Maybe, maybe not, right? We were learning to be a nurse. But two things I observed from her, I just like you to stick to these two words: empathy and grace, right? Empathy and grace. She worked long hours. I was like, nobody pays you by the hour, right? Mommy, let's go home. And she lugged charts. You remember the charts, the brown charts? She'll take it home and she'll have to write notes. Then she'll go early in the morning because she has to meet with somebody who has to come earlier because they have to go for work, right? Because she's working with low-income people getting HIV are truck drivers, and their wives are, widows, so she wants to meet with them. Two things I saw: empathy and grace. Really, really touched me. Little did I know that I'm going to follow her pathway to be a case manager / social worker, right? So what do they say? They don't say, go call an RN care manager. They say, call a social worker. Beginning, I'm like, I am not a social worker. I'm an RN. We take pride in that, right? But today I'm okay to say I'm a social worker. You know why? Two things: empathy and grace. So I was just kind of listening to more of empathy as I was preparing for this. And I came across a professor in, let me see. Yes, she's Dr. Helen Rees, an associate professor of psychiatry at Harvard Medical School. And she created an acronym for empathy, okay? Just stick with me. E for eye contact. Okay? So that's the first thing that anyone does as a mom. Some of us have been moms. When you hold your baby, yes, you know the gender, but what is the first thing you do? You look into the eyes of your child, right? So the first contact, eye contact, the letter E is empathy. It says, everyone needs to be seen. I repeat, everyone, you and I, need to be seen. I think so often in our practice, we have a lot of practitioners here, it's easy for us to reason out, to be busy, to just pass through patients, right? Pass through practice, and some of us are leaders. It's easy to go through our team and go fast, right? And miss that eye contact with them. So the first thing is eye contact for empathy. Everyone needs to be seen. So just think, am I able to do that every time I have an encounter? Be it your child, be it your spouse, be it your mom, be it someone in the supermarket, anywhere, right? Empathy. First is eye contact. The second letter, M, is muscles of facial expression. Me, I cannot have a poker face, right? If I'm sad, I'm sad. If I'm angry, I'm angry. My kids are like, Mom, why is your face like that? It's scientific, right? Because we are wired that way, right? Our expressions follow our facial expressions. So when you see a patient, when you see a colleague, when you see an employee coming to you with something that they've done, good or bad, they are in distress, how do we respond? I think we all have a control over that, right? We all will be able to give them that unbiased facial expression to say, you know what, I'm here for you. It is a challenge to do that intentionally, I think, because your first response would be, you again, or you see a repeat offender at your clinic. I thought you can be off my clinic for at least, another 30 days. Or you would see a dialysis patients who are, are not compliant, ending up in ER, and you get those calls. So M for muscles or facial expression. P is for posture, empathy. P is for posture, right? It's a powerful conveyor of connection. A study says that they did a study where physicians or providers sat with their patients while they examined them or talked to them, or they were at the office. And the studies revealed that the patients rated them 3 to 5 times or 3 to 4 times higher than those who went into a patient's room and say, hey, I'm so-and-so, right? Are you doing okay? Yada, yada, right? Posture. Do we take time to sit? Be it listen to our family, our loved ones, anybody we do life with, our patients, our employees, do we take time to sit? Posture. A is for affect. It's an expressed emotion. Try to see the effect in others. If I do see the effect in all of us, I think I see an excited effect, an intrigued effect, right? So I think that will help us, guide us to how to help support that person. A is for effect, be it our patients, be it our colleagues or our employees. T is for tone of voice. Is my voice on the edge or is it a calming voice? And am I going to be saying, okay, come on, let's do this one more time, or how can I help you? It's the vice versa. We work with someone, with our patients. How is their tone of voice? I often, as a case manager, find myself going into a patient's room where I'm called, because I'm the supervisor/manager, all of those roles, to say, there is a challenging patient situation, why don't you come? Okay, not my choice, but that's what I wear, right, as my profession. So how is the tone of my voice? How is the tone of the people that I work with, right? That says a lot. H is for hearing the whole person and understanding the whole context of others and being non-judgmental, right? I think in our fast-paced world, we are like, just give me something in 2 minutes. Tell me in 4 words. A child comes to you, come on, I'm busy. Just tell me one thing I can do right now, right? So hearing somebody through and getting to know where they're coming from is part and a bigger part of empathy, right? Y is for your response to the feelings. Study says that it is our human nature that when somebody is sad, empathy, getting into their shoes is easy. When somebody is mad, it's easy to get mad, right? When somebody has got a high-toned voice, our tone of voice also raises, right? But how is my response when I want to be empathetic? I came across something called Sambo.